Hi, I'm Lily. I'm gonna be your nurse today. So I would just check I'm gonna log in and then check the documentation just to make sure that he has an order for a catheter, which he does. I'm gonna provide privacy, so we're just gonna shut the door and then close the curtain. Do you have any allergies? No? Okay. Do you have any allergies to iodine or latex? Okay, good. And then what's your birthday? Okay, perfect. I'm just gonna go ahead and pull this down. And I'm gonna check the patient's wristband to make sure they are who they say they are, and they are. Okay, we're just gonna pull those down. I should have grabbed some gloves.
You're okay.
I'm just gonna bring these over. Okay. So we're just gonna go ahead and clean you off, and then I will tell you when I'm getting ready to insert it, okay? So we're just gonna pull this back, and then if I needed to, I could provide a drape over the patient, but we don't need that at this time. I'm just gonna have the patient help me bend his legs. Over here. Okay, and we're gonna clean the peri area, starting at the tip, and making sure that, that we're going in a circular motion. And then we're gonna use a clean part of the rag. Okay, and then we're gonna fold it over and use another clean corner of the rag. And then we'll get a new one because that's not clean anymore. Okay, and then I would wipe a third time, and then I'm gonna fold it over again to a clean side and just wipe under here. Okay. All right. Okay, and I think that's all we need here. He'll stay together. And then I'm gonna perform hand hygiene again. Okay, and then at some facilities they require us to name and date the catheter. This one doesn't, so we're not going to use that. Trying to get to my list. Oh, stop it. Okay. And I'm just making sure that it's not touching my drape. We're just gonna wipe that right there. I'm just making sure not to touch the outside with my sterile gloves. Okay. Where did it go? I'm just making sure that I'm not touching the patient directly. And then we're going to place this over. Okay. All right, and we don't need those. And I'm just going to go ahead and uncover that. And I'm just going to stick it in here and then leave it on until I'm ready. Okay. And I'm going to go ahead and hook on my saline flush. That way it's ready to go. And then I'm just going to go ahead and we'll clean the patient and then set that on the sterile field. Okay, so I'm going to grab right here with one hand, and I'm just making sure that my sterile field is still within my sight so my back's not turned to it, and we're going to start at the tip and go in a circular motion. Making sure that we use all three. Just make sure it's all clean with the iodine. Okay. All right, and then I'm just setting that on my sterile mat there. Okay, Mr. Jones, I'm gonna go ahead and insert this, and I just want you to take a deep breath for me, okay? It's gonna be a little cold. All right, there we go. Okay, I'm just gonna have you take a deep breath for me, and we're gonna slowly insert it. And I'm just twisting as I push it in, and if I feel any resistance, we would just slowly try to twist and push. And we wanna make sure that we get it past the prostate and that it's not enlarged and we're not hurting the patient. And then I'm gonna stabilize it with this hand. And for this catheter, we only need 5 milliliters of saline. So I'm gonna go ahead and do that. And then we are using a size 12 catheter. And I made sure to double check that was the correct size for my order. And then I'm just gonna go ahead and disconnect that. Okay, and then I'm gonna go ahead and pull back and make sure that the balloon is in place. And it is, we're getting resistance, so that's good. So I am gonna go ahead and hang my bag, and then we will secure it to the patient. And I'm just making sure to secure it to a solid part of the bed. We don't wanna hang it on the bed rails or set it on the floor or anything like that. Okay. First, I'm gonna roll this out and put it on that. And I'm gonna go since they're dirty. All that dry. All right, Mr. Jones, we're just gonna attach a sticker to your leg to keep it in place, okay? Gosh, my hands are still wet. Okay. All right, and then I am sticking this to his right leg. If I can get the darn thing done. Okay, so I wanna make sure that there's some slack, so that's where we stopped. And I don't want it to tug on the patient. So probably right there. I am gonna go ahead and just Velcro it. And then attach it to the patient, so that way I know where it's not going to cause them any pain. I can get the sticky off. I'm gonna try and make sure it's okay. Throw that away. Okay, and we're all done, and then I would put a brace back on him, but we don't have one over here. And then I'm just gonna help the patient position his legs and get comfortable. I'm gonna cover the patient back up. And then I'm gonna make sure he has everything within reach. And then he's got a water on the table. Okay, I'll be back in about an hour to check on my patient. And then I would just document that it was inserted, had the proper amount of fluids, and what leg it was on. And my patient seemed to tolerate that well. And then I'm gonna perform hand hygiene.